For example, I run a free clinic here in Albuquerque a couple of times a month. I have to turn people away that are waiting to get health care. However, if I accepted Medicare, I would actually be breaking the law by providing that free care, because Medicare has a rule that I cannot provide care less than what I would charge a Medicare patient. So some of you may not understand that. I also cannot, I try to keep my office charges very reasonable, because I think that's where it starts. It starts by us as physicians keeping our costs down and being very efficient. However, if I were to accept Medicare, I could not offer what I would think is a reasonable rate or a reasonable charge, again, in violation of those rules.
Thank you, Dr. Vito. Representative Heinrich, you wanted to wrap it up?
I just want to say, I do think there are a lot of places where we can actually agree on what the facts are and work on those things. And Mr. Gessing brought up the sustainable growth rate, which is unsustainable, which is under reimbursed doctors across the country. That does get fixed between the budget and 3,200. In addition, and it's absolutely unfair to expect somebody to provide service when they're going to be losing money at that reimbursement rate. And I also do think that the issue that Dr. Vigil brings up of regional disparities too, of here in here in New Mexico, are doctors not getting reimbursed as well as doctors in, say, South Florida or Boston. That causes a shortage of primary care doctors here in New Mexico, and those are things that we should all agree to work on together.
Thank you. Okay, was it Naomi or Rick next? Naomi, you want to start?
Sure.
We'll get to everybody.
Well, in a worst-case scenario, from my point of view, if we wind up without a public option, what can be done to rein in the pharmaceutical companies and the insurance companies so they don't have that?
First, I'd say I think we're a long ways from there, and I think we need to continue to, I can with a great deal of certainty say that there's enough of a consensus that the public option will emerge from the House with a very substantial majority, and that the House will send conferees who are committed to that. The issue of insurance reform and pharmaceutical reform, I think the things that we need to continue to be committed to in the bill that help level the playing field are things like eliminating rescissions in this bill that says if you're honest, you don't commit fraud, you're honest and you fill out that application for your insurance plan and they approve it, when you come down sick, they can't just kick you off the rolls. That happens all the time. In addition, the issue of pre-existing conditions. If you have diabetes, you should still be able to buy in to an insurance pool, and that pool can still be profitable. It's the cherry picking that we get in trouble with, where one insurance company is competing with another. We need a level playing field, and we need to eliminate some of those things. And when it comes to pharmaceuticals, the biggest thing I think we can do is to require our government programs like Medicare Part D to do the same thing that we do in the VA, which is to require that they negotiate for lower drug prices.
Would any of the other panelists like to make a comment on Naomi's question? Mr. Gessing?
Naturally, I would take things in a slightly different direction. One is we went down this path starting in World War II, where we give tax benefits to employers. We need to give the same tax benefits to individuals. That will cover you from worrying about changing a job and losing your insurance, or if your employer goes out of business or some other thing like that. Plus, if you are the one paying for your insurance, more than likely you will see a situation where insurance turns back into insurance. What we have is prepaid care in America, where every little thing is covered by insurance. Insurance should be in a crisis. If you have a serious medical problem, day-to-day health care expenses should be taken
out of your own money and fund it that way. That'll increase cost competition and price competition. And lastly, interstate purchases of health care insurance across state lines. We do have a lot of unfortunate states where it's largely a monopolistic situation with insurance companies. I don't like insurance companies as much as the rest of you. I don't like them at all. They are not in a role, though, that they should be in. They should be in a role where they provide the only emergency services, like your car. If you get hit by, if your car is in an accident, you have the insurance company. If you put gas in it or put oil in it, get the tires changed, the insurance company has nothing to do with it. Thank you.
Thank you, Mr. Gessie. I could ask the audience to please refrain from too much comments so we can get through the questions. Dr. Behill or Dr. Richards, did you have anything to add to that?
Well, the only thing that I'd like to add is I'd just like to remind folks a little bit about some of the statistics around healthcare costs. And again, I'm an emergency medicine physician, so in some ways that's the way that I look at a lot of the healthcare issues. And let me just tell you a little bit about you and your issues with emergency care. 40% of the people in this room will visit an emergency department at some point this year. 40%. The overwhelming majority of you, if you had to pay for this without insurance, would find it a completely unacceptable and undoable proposition. The average emergency department bill in the United States is over $1,000. And it's very easy for an emergency department bill to be $7,000 or $8,000. Things which are completely, totally beyond your control. If you should happen to be in a car accident or fall, those kinds of visits to the emergency room can create economic hardships which are in part responsible for why Americans can't afford health care and that it results in such a high rate of bankruptcy. It is the cost of it just really can't be borne by just out-of-pocket most folks.
Thank you, Dr. Richards. Dr. Behill with on-call urgent care. Sir, please. Dr. Behill? We're going to have to ask you to leave as you keep commenting. Dr. Behill, please.
Yes, with all due respect to Dr. Richards, as an independent practice, I believe that free market systems can foster and engender independent clinics that are very competitive. For example, we can take that $1,000 emergency room charge and turn it into maybe a $150 to $200 charge in an urgent care ambulatory care system. However, that means that we have to shift that care. We've grown up in a society where we don't have that those structures available. The infrastructure has to support that. We all know that after hours and weekends, there's no other place to go except the emergency room. Even if you can pay out of pocket, you're going to get a $1,000 charge for something that should not cost more than a couple $100.
Thank you, Dr. Behill. Mr. Swanson, you have been very patient. I'm starting the timer right now. Please ask your question.
Well, I'm for an insurance plan, but what my concern is, how is Congress going to process to pay for this plan, and how is we going to have enough medical providers to cover all this 47 million people that don't have health insurance right now?
Thank you, Mr. Swanson. Representative Heinrich?
Well, I'm going to start with the second one because we talked a little bit about the provisions that pay for the current program, both the savings and the surcharges on income, the pay-for-play provisions where when you reach a certain size, as an employer, you either have to provide health care or pay in. If they go into the public health care exchange, you have to pay into that system. But in terms of the second issue, it's absolutely critical that we realize that Congress can't fix everything in a system that has state ramifications, has local ramifications, and has ramifications across the United States in terms of accrediting agencies. We have to address the pipeline issue. Congress can help with that, and there are incentives in this bill to create more primary care doctors and more generalists, but we're also going to need the help of our institutions that teach medicine, the accrediting agencies that deal with that. We need to produce not only more docs and more healthcare providers, nurses, nurse practitioners, you name it, physical therapists and others, but we're also going to need to, in addition to covering the uninsured, get in front of this baby boom wave that we've seen coming for a long time and that we have not adequately addressed in our education policy and with our pipeline issues.
Thank you, Representative. Dr. Richards?
Yes, I'd like to just provide a little additional information about medical education in the United States. So we've seen